Hello, I'm Dr. James Horwitz of Rainbow Pediatrics. Today, I'd like to speak to you about managing your child's sleep problems. Sleep disorders are common in childhood and can often be managed with a few simple techniques. Up to 30% of children experience sleep problems at some time, and they can have a significant effect on daytime behavior as well. Sleep problems can be with the quantity of sleep or the quality of sleep. Sleep quantity can be affected by problems falling asleep or waking from sleep. Sleep quality can be affected by frequent, repetitive arousals from deep sleep. For children that have trouble falling asleep, the key phrase is, be consistent. It is important to have a bedtime routine. This may consist of a bath, rubbing on some lotion, and reading a book. A transitional object such as a blanket or a teddy bear, which substitutes for the caregiver, is good for children over a year old. Each time your child cries out for you during sleep, try waiting a little longer before attending to him. Then gently comfort him briefly and unemotionally, and leave the room. Return to check on your child every 15 minutes until he falls asleep. To do this, you must be able to listen to your child cry and not give in. If you can get through this process for 2 to 3 nights, it should all start to work out. But if you give in after, say, 45 minutes, your child will learn that crying pays off and may actually cry longer in the future. So, be consistent. For children that have trouble falling asleep, try moving bedtime later, say 10 p.m. instead of 8 p.m. and then slowly work backwards a little bit each day to the desired bedtime. For children that have trouble maintaining deep sleep, it is important to reinforce good sleep hygiene. At a time when they are not getting ready for bed, review the rules. When you go to bed tonight, you will stay in bed. If you wake up, you do not get a drink of water, you do not watch TV, and you do not walk around the house. You must stay in bed unless you're going to have a bathroom accident or there's an emergency, and make sure they understand what an emergency is. Use a reinforcement system, such as a sticker chart, and make a contract with him. 4 stars this week, and we'll go to that movie on Saturday. Most children over 15 months of age do not need to sleep with a bottle or a pacifier. It is simply one more thing to wake up and look for in the bed at night. It is normal for children to snore in their sleep. However, they should not have to breathe out of their mouth during the day. And they should not have prolonged periods of breath holding during their sleep, which could be a sign of obstructive sleep disorder. You should discuss this type of problem with your pediatrician, as a medical or surgical intervention might be needed. Medications are the last resort for sleep disorders of childhood. However, in certain circumstances, some very mild and safe medicines or dietary supplements can be tried. Discuss this with your pediatrician as well. To summarize, most pediatric sleep disorders can be cured or at least greatly improved if you, the parent, do the same thing every night. Your child will know what to expect and will adjust his behavior accordingly.